without further ado, let me introduce Shannon. Dr. Jarrott earned her PhD in Human Development and Family Science at Penn State and was a faculty member at Virginia Tech for 16 years. She's currently a professor in the School of Social Work at that other OSU, Ohio State University, and an internationally known investigator in the area of intergenerational relations. As the first director of research for the Department of Human Development Adult Day Services at Virginia Tech, Dr. Jarrott directed the Neighbors Growing Together intergenerational program comprised of Virginia Tech's Adult Day Services and the Child Development Center for Learning Research. This program has been recognized with university, regional, and national awards, including the Generation United's Program of Distinction designation, and it was a finalist for the prestigious Eisner Foundation Intergenerational Prize. Currently, Shannon is directing her second USDA NIFA Sustainable Community Project grant for the Children, Youth, and Families at Risk program. The first one tested the feasibility of implementing evidence-based intergenerational strategies in community-based childcare settings. The current one is entitled Food for a Long Life and applies intergenerational strategies to improve knowledge, access, and consumption for preschool-age children, older adults, and their families. I'm pleased to let you all know that we are currently collaborating, Shannon and I, along with Oregon State colleagues John Geldof and doctoral student Shelby Turner, on a project funded by the Foundation for Aging. Our project involves creation of a psychometrically sound measure of intergenerational contact. And finally, I wanted to share this academic intergenerational tidbit with you. Shannon was an undergraduate at UC Davis and took her first adult development and aging class, which was taught by Carolyn Aldwin. So it's really a small world. I want to really thank Shannon for agreeing to do this talk virtually today, but hopefully we can get her to our campus sometime next year. Shannon, the Zoom screen is yours.
All right, thanks, Karen. And Carolyn, regards to you, and hello, and to Shelby and my other colleagues I've gotten to know through this collaboration. I'm really glad that you invited me. I had so looked forward to visiting Corvallis for the first time, and it's just going to have to be a journey that I make out there on another day. Though we have finished our year here at Ohio State, I can still remember what it's like to be in your mid-semester in May from when I was at UC Davis, and where I was really fortunate to meet Carolyn. She really changed my life, so I'm very grateful for that, and grateful that she continues to be a presence in my life. I'm really delighted to be part of your seminar this semester, and my topic has really modified since I first signed on for it, but I will still get to talk about my favorite subject, intergenerational or IG relationships and programs. And my objectives for our time together are to define social compact, ageism and age segregation. I'll characterize how ageism influences both current and future older adults. I will introduce the Reframing Aging initiative, probably a couple of you at least have heard of, and I'll describe how intergenerational programs can reframe aging. The social compact is an unspoken agreement, usually. There are probably a couple of written versions of it someplace, that are held between the generations, that is offered to younger persons, will be returned to adults, usually older adults, when and if they need it. It may be an expectation that's held within families, but it's also held within societies. This understanding that adults, older adults, pass things on to younger people in expectation that it will be returned. There have been a lot of people who've been lamenting the deterioration of the social compact, but this has been going on for decades. I don't put a whole lot of faith in it, and we could spend an entire seminar series talking just about evidence for and against support or violation of the social compact. Certainly more time than we have today. It is certainly a subject that is on the minds of people these days as we miss the contributions of older adults and we miss our opportunities to contribute to their well-being as we isolate ourselves from many routine contacts. Age segregation is a separation of persons based on age. It's physical, but it can also be virtual or technological if we think about the means that we frequently rely on to connect with each other. Partly it results from normative changes that are associated with people who differ across ages, but it largely ignores the differences within age groups. It also reflects a view of development as a linear movement through roles and environments. And currently, we see a lot of age segregation as people are banned from visiting resident. Oh, I built in animation here. That's coming there. Sorry, I try not to use animation because I forget about it and then it surprises me later on, as it did just now. So we see this age segregation when we find signs like this, barring visitors from residential care programs. I was surprised to find this image. Menards is like I call it like a Walmart for men. It's got hardware and shelf-stable food, and they're not letting children under the age of 16 or your pets into the store because of COVID. And so this is happening in a lot of different places. It's happened as well to my parents who are 74 years old and were told not to return to their volunteer position at the food bank because their age puts them in a vulnerable category. So they are being age segregated. Ageism involves decisions, treatment of people because of their age. Most commonly, we think about it with regards to older persons and how they're treated, but certainly it can happen to young people as well, as people behave towards and think about young people based on assumptions or stereotypes that they have. You know, ageism is not just funny greeting cards that stereotype old people for having sensory impairments or poor control of bodily functions. It really does affect all aspects of our health. For example, recent data from AARP report that almost the majority of workers have reported age discrimination. And this is despite federal legislation that protects older workers from discrimination. And an older worker in the US is 40 plus, not even qualifying as an old person. There's a lot of attention being paid to intergenerational workforce issues these days. We see it in gray literature, we see it in research literature. We see discrimination in the workplace that occurs because of the opportunities that are provided for employees to learn new skills and new technology. Older adults learn differently, typically, than younger persons. And when those learning styles aren't accommodated, that amounts to a type of discrimination. We know older people who become out of work take longer to find employment than younger persons. It's really problematic. And what has something that has bonded Karen and Shelby and I together is this interest that we have about ageism affecting the interest of new professionals in working with older adults. It is very difficult to anticipate how we're going to meet the needs for specialized training and care for older adults. And it's really, really a great concern that we have. Related to that, physicians who lack specialized geriatric training, which exists because of ageism, will normalize treatable conditions that older adults seek relief from, thereby increasing significant and costly health conditions. As well, ageism contributes to stress, which we all know is associated with health, and in fact becomes a chronic stressor because we are surrounded by these images and stereotypes that perpetrate these negative ageist models that we carry. There's some really interesting literature. I've got this picture here on the lower right-hand corner of Dr. Becca Levy from Yale University. And I'm grateful to have been inspired by her work to pick up the baton and do some of the research in this area myself, that how we think about aging affects the way that we behave. And so it really is the case that ageism is affecting not just current old people, but future old people. Young people who've got lower self-perceptions of what aging is going to be like are going to make decisions about what kind of behaviors they will and won't undertake. And this in turn affects their health. over time, as we get exposed to all of these negative stereotypes, we adapt them, we self-stereotype. This is where Dr. Levy's work has come into play. People who have got more negative self-beliefs, they have worse cognitive performance, they have lower stability during locomotion, they even experience lower life expectancy. Fortunately, there is a contrast to this, and that is that people with more positive self-perception have better health and up to 7.5 years longer life expectancy. What's really important about Dr. Levy's work is that she's not just making a correlation where we might say that people who live longer have better health, so of course they have a more positive attitude. Her sample sizes are such, collected over different periods of time and longitudinally, that she is able to conduct the statistical analyses that allow her to assert that it is the attitude that is affecting the experience of health and old age. So what do we do about the problem of ageism in our society? I'm going to keep checking my notes. I tried really hard to figure out the technology so I could have my notes on my screen and PowerPoint over here, and that wasn't an option. So I apologize. I'm still reading from my notes in print. So Reframing Aging is an initiative that is supported by leading gerontology and geriatric organizations. These include AARP, Atlantic Philanthropies, the Hartford Foundation. Even if you haven't heard about Reframing Aging, you've probably heard about these groups. And Jacob's put up this poll. I am curious to find out how many of you will find Reframing Aging to be a new initiative. The group that I'm primarily associated with, the Gerontological Society of America, they are a partner in this as well. National Hispanic Council on Aging, National Council on Aging. There are a lot of heavy hitters, if you will, who are involved. And it looks like we got a pretty decent representation of people who know this program. And thankfully, for some of you, it'll be new. And I'm grateful for that. I'm going to walk us through a couple of steps. And as I mentioned earlier to our host, this is still an education for me. My hope is that this is valuable for students and new professionals to consider how we spend so much time in school building our expertise and being able to reveal and share the facts in the areas that we study. But these facts may not be consumed by very many people in the general public. You know, that's how a lot of our work goes. As well, depending on the choices that we make about how we present the facts, our messages may be received differently than we intend. And so Reframing Aging is a terrific illustration of how we need interdisciplinary collaboration to address the problem of ageism and help to create a collective effort to support the welfare and well-being of all of us as we age, because we are all going to join that group. So in this, I went a little bit quickly over that, right? So I'm going to talk to you about these 3 phases that these experts went through. This was the Frameworks Institute, if you wanted to look them up. They mapped the gap. These are very cute little titles. Tested cultural narratives, and then are now finally at the stage of pushing out, trying to get people to adopt these effective cultural narratives. And I'm going to see, all right, I can close that poll. Thanks. So in this mapping the gaps, the researchers went out on the street, did interviews with 2 different groups of people, the general public and experts in the field of aging. For the general public, who are represented on that right-hand side of the figure, they asked people to talk about what it means to get old, what they think their aging will be like, and to see what kind of support there was for policies that would support community involvement in achieving welfare for older adults and all the rest of us as we age. And then they asked experts to describe, what are the facts about aging? And they identified areas and then looked to see how they were similar or different from each other. And unfortunately, we've got all these experts, people like Karen and myself, who are talking about this is what we know about the diversity of old age. It doesn't match up very well with how the public understands aging. So what are we going to do about this? For example, if we look at that first row, how should people approach aging? You know what the conversation from the general public sounded like, right? You have people saying, I'm not going to get old. I'm going to fight aging every step of the way. I'm going to reverse aging. This isn't going to happen to me because I know what to do about it. Experts would tell you, you don't want to just fight aging. There are some good things that come from it, and so we can embrace it. If we move down to that next item about what it is that determines how someone experiences aging, the general public would say, well, I guess it's just up to the individual. Maybe suggesting a belief in genetic influence, maybe suggesting that it's all about decisions individuals make, and so their experience of old age is up to them. But we in human sciences know that that's not the case, that systematic discrimination makes a difference in how people age, that the structure of services and education resources for people will affect how they age. So we have really big differences. In the public, they don't even think about ageism being a problem because it is so deeply ingrained. We're exposed to it all the time. In the aging field, we know that it has a significant impact on health. Finally, public opinion is that policy doesn't have much of a role in how people experience old age. And the experts would tell you that indeed, the current state of older adult welfare and people who are moving into old age, the future welfare of society depends on the role that policy plays in the lives of older adults and those who are in the community that they belong to. So with this first stage completed, it's really disappointing, a little bit discouraging, but with these gaps identified, the Framework Institute was able to move on to this second phase. And in this, they developed and then they tested in these different experimental settings these cultural narratives and these ideas that they wanted to see what's the best way, how do we make choices about how to frame facts about aging and present it in a way that people will see it's important to address ageism and there are things that I can do to contribute to this effort. So this first framework, the two that I'm going to share with you were associated statistically with improved understanding of the aging experience, improved attitudes about aging, and endorsement of policy that could affect older adults. And I'm going to stop for a second and check where I am in my notes, and I guess it'd be a good chance I can see if there are any questions, Karen, or comments that I could address. And you are muted.
I don't see any right now.
All right, I found my spot in my notes, so that's perfect. Thank you. So the investigators offered 5 guideposts that should be worked into a confronting injustice narrative. It looks like a lot to me to fit into a casual conversation. I don't know about you, but you could probably find 1 or 2 guideposts within this list that you could use when responding to ageist statements or behaviors. And let's say you're preparing a presentation or you're called up by your local newspaper to offer your opinion on how the pandemic is affecting the elderly. We see that all the time in the news these days. You could have an elevator speech that reflects these 5 points, and it probably wouldn't take too long to sort out. These reflect choices that we make about what to include, what to leave out. You can see here that as we move down towards the bottom in that 5th point, that it offers examples of solutions. So there is some hope, and that's very different from the public's cultural model that there's nothing that can be done. So critical here are naming what it is that the concern is, offering examples of what ageism looks like, to recognize that we are immersed in implicit bias, in this case towards against older adults, and then to offer examples of ways that we can respond, that it doesn't have to be like this. Moving on to the next narrative, this is probably the narrative embracing the dynamic that resonates the most with me. It has some different guideposts, still just 5, so not too many things to work into a short elevator speech. It still involves explaining the situation and offers hope for responses, active, solution-focused responses. And I like this one. I like to take a strengths-based approach, and this kind of puts the onus on all of us. When America sees an opportunity, it moves into action. Boy, do you hear that language these days as we talk about the pandemic? We're in this together. That's reframing language that we can apply to older Americans and the community that we all belong to that's aging. Right? What do we have going on right now? Society just hasn't figured out how to make the most of the talents that older persons bring because of the long lives that they've had, because of the challenges that they've worked through, because of the solutions that they've identified. And there are things that we can do about it. Now, I didn't make up this item here, number 4, as a possible solution. This was actually identified by the Frameworks Institute as something that really resonated with people, and that was introducing programs that bring together older adults and younger children in community settings. So that's a nice transition for me, but almost. I don't know about you. I mentioned earlier, trying to remember 5-point narratives, it could be a little bit overwhelming. So I'm going to turn now to this quick start guide. And Frameworks created this as well. We have all heard, if you take a minute and look down, maybe, I don't know, Jacob, if we can do this on the fly. Take a look down this left-hand column and tell me which of these words and cues are you, or maybe you could report on somebody else you've heard, because maybe you don't use any of these words or cues. Have you heard recently used to talk about older adults? And Jacob, if that's too short notice so we can't do it, that's no problem.
We can't set up a poll for that, but what we can do is just have all of our participants put it in the Q&A section, just their short responses.
All right. Thanks. I'm going to keep going. If you see something that you've heard yourself say, or your roommate, or somebody in the grocery store, I think we can probably all resonate. And the idea is simply that now that we know better, we can try and do better in the language that we use. For example, I'm developing an online class on health and aging right now, and I've built into week 12 a unit on reframing aging. And the trouble is that now I realize I really need to go back and review the language I've used through all 11 other units to make sure that I'm not guilty of using these negative words and cues. I would guess for myself, looking at these boxes in red, that I could be guilty of that second item, of emphasizing choice and control that older adults have over their experiences. I can promise you, I did not use the word tsunami or tidal wave once in my online class. And there are some things that I can try and replace these with. So if you like, get a screenshot of this little chart, save it on your phone, look at it every once in a while, or you're going to hear, maybe even your grandmother talk about the tsunami of old people coming along. And you can say, hold on a minute. This is a great opportunity for us with older Americans living longer and healthier lives. This initiative, Reframing Aging, is even responding to COVID-19. So I wanted to touch on that with you. They had a webinar, the Gerontological Society sponsored just at the end of last month, recognizing that the news that was coming out about COVID and older adults being in a categorically vulnerable group They said this is the same kind of thing. There's just so much concern, and our own Karen Hooker has had an article published in today's local newspaper about the rise in ageist assertions and language and behavior that older adults and society are being exposed to because of COVID. So if you take a look at the before and after, you can see maybe some differences. Differences, for example, that convey that people are responding, and it's states that are responding. It's not just the individual older adults' responsibility to be to recognize their vulnerability, or to self-isolate, or to make sure that nobody is around them who is at risk. And it also offers some hope. We can reduce exposure to the virus through community actions that community is involved in. Did we get any comments? I'm going to just back up before I'm about ready to leave Reframing Aging.
Yeah, we did get.
Willing to out their friends or identify words they'd like to try and change in their own communications?
Yes, we did get some comments. Somebody who said struggle battle was something that they had heard. Another person said, my grandmother once saw a book on aging and life course on my desk, and I'll never forget that she said, I need some help in that fight. And then another person says, social context is important, but so is agency.
Mm-hmm. Yeah, individual agency that we want to support. And I think that's, Karen, where I get into trouble with that control and choice, is that emphasis that we want to give on empowering older adults to be respected for their voice and their choice, but it doesn't mean that they are solely responsible for how they experience old age. Yeah. Thank you. I think we're doing okay on time. And if I don't get through all of my next objective, you can just follow up with Shelby Turner. She's going to take care of it. I have a real gift for you today, and that is pictures from the 1980s from my family scrapbook. And that is because this is the reason that I do the work that I do. The old woman in these pictures is my grandmother, and I have a little brother in that right-hand picture. I was 16 when he was born, and so I had a nice perspective to think about the role that relationship that she and I probably had when I was too little to remember. And so really since that time, he was born while I was still in high school, I have been interested in helping young and old people who don't have family connections like my siblings and our nanny did, to have the benefits that can be achieved with intergenerational relationships. So that's where these pictures come from, a blast from the past. Yeah, and rather than assume that everybody knows what I'm talking about when I say intergenerational relationships and programs, I will offer a couple of definitions there as well. So with regards to relationships, these are going to be, it's very important to keep in mind, skipped generation relationships. So we're not talking about a parent and a child, a grandparent and an adult child, at least a skipped generation. Sometimes those people are quite close in age, but that's the best that I can offer. And they might be familial, skip generation relationships, and they might be non-familial. That's where most of my work is, and that's most of what I'll be talking, that's everything I'm going to be talking about today. Also, when I think about an age range, I identify youth as 24 and under. That's a pretty big age range. But because so much intergenerational work is done with service learning and field placement with university students, and there's a lot of attention to how those kinds of programs can support attitudes towards aging, interest in going into the aging field, we want to be able to include those pretty traditionally aged college students, even if they've changed majors 5 times. And then for older adults, we pick up with adults 50 and older. Many people would say, 60 or 65 and older. So you'll see some variation, but in general, that's what I'm talking about. With regards to intergenerational programs, I'm talking about those that bring young and old people, skip generation, together for shared interaction and for mutual benefit. So I am not talking about a place like a library where the kids may be doing something in this room down the hallway while the older adults are doing something different at the same time, but they aren't coming together. Not talking about rec centers where people might be mingling but are not intentionally being brought together for shared interaction. So what I built in here, and I think from Jacob, you would just need to type this into the Q&A box. I've told you my story, why I do what I do. I wonder if you have had a significant intergenerational relationship. Maybe it was just with your nanny or your grandfather. Maybe it was Girl Scout or choir singing at the nursing home, bingo at the nursing home, something else. I'd be curious to know what your range was. So you might just type in something short. You know, it might be choir at the nursing home, great grandparents, whatever the case might be. We'll just take a minute for that.
So Shannon, you're wanting people to just give some examples in the Q&A, right?
Mm-hmm. Or you might just type in none. You know, maybe your grandparents lived far away or had deceased before you could remember them.
So familial or non-family, either one, right?
Yeah, either one.
Okay.
Just curious if maybe we've got any representation of some of the types of programs I'll talk about today.
So someone said, I had 4 living grandparents relatively close by for the majority of my childhood and 2 great grandmothers. How lucky.
Yeah. You know, I'll often observe when I'm teaching an aging class how you couldn't buy, in 20 years ago, you couldn't buy great grandparent or great grandchild cards, and now they're in every Hallmark or greeting card aisle. Lucky to have those folks around all this time.
Somebody else typed in grandparents and great grandmother, as well as clients with domestic violence.
Well, thank you for that work. All right, I think I'm going to keep moving along. Karen's muted herself, so I think she's ready for me to move along too. And I'm going to give you just a little quick history. And one is that intergenerational programs, and it's kind of, I'm going to guess at the audience in here that you don't go anywhere near back to 1965, but intergenerational programs are relatively new compared to other educational and human and health services that are out there. And foster grandparents is the oldest one that I know about. It was established in 1965. It's also unusual for having federal sponsorship. They are funded by the Corporation for National and Community Services. This is the mission statement. I looked yesterday or a couple days ago for their mission. And so it describes, foster grandparents are role models, mentors, and friends to children with exceptional needs. Program provides a way for volunteers age 55 and over, see there's a different definition of old, and to stay active by serving children and youth in their communities. And so it reflects, I think, an older view of intergenerational programs, and that is one generation is helping another. The older adults are serving children. They are friends to children with exceptional needs. Even though I know if you talk to anybody at foster grandparents, they would emphasize that the older adults get something out of this as well. This language reflects, like I said, just an older idea about kind of unidirectional engagement or service. If foster grandparents are still active today, that picture in the lower left corner is from a group in Central Virginia. It's really cool. I have a former student who directs the foster grandparent program there. So if you're curious to learn more, I'd be really happy to put you in touch with Brandy. It is an amazing program. I know those older adults and their students just are missing each other so much right now. And I'll talk about an outlet that Brandy has found for them. I'm going to give you just a smattering of what contemporary and newer intergenerational programs look like right now. I'm going to try and keep track of my time too. And what you'll find in these programs is that they will talk about the mutual benefit that their young and their old people, as well as the staff, as well as the families, as well as the community receive when young and old people come together. I would always say that intergenerational programs are primarily limited by our imagination. And many of you have likely participated in service learning programs. They can involve school-age children, lots of university students. That picture in the upper right-hand corner is from Project Shine, which is students helping in the naturalization of elders. This program has been replicated multiple places around the country and involves, say, social work or public policy or government students working with immigrant elders to achieve their naturalization. Shared sites are the program that I am most familiar with. That picture in the middle is taken from One Generation. It's a shared site care program. It's in the Los Angeles area, and it involves, in this case, a child care and a preschool that are in the same, they're in adjacent buildings with an adult day services program. But you'll also find them in retirement communities where there may be a school or a preschool, but they take some unusual shapes too. There's a group near Boston that has got the senior center located within the area high school. Again, these are strengths-based approaches to utilizing the resources and opportunities that we have. You know, so often these programs come about because their founders will recognize that these members of earlier and later generations are so often viewed from a deficit lens in which they're looked at for what they need, what they don't have, what they can't do. And instead, the creators of these programs say, they have talents to share. They have talents to share with each other and with all of us. That co-housing, the picture below, may or may not be familiar. It is from the Portland Bridge Meadows program. There are a couple of Bridge Meadows residences in Oregon, and what they do is they offer affordable housing to low-income older adults. Those older adults are expected to support families that are adopting children that they have fostered. It is a pretty remarkable program. Social worker on site, wide range of services that are provided. With regards to co-housing, you might also have heard, because these pop up in like USA Today and the Today Show and things like that, programs in which poor students who have a hard time finding affordable housing live in a senior or a retirement older adult residential community with the expectation that, you might guess by the violin and the piano in the picture, that these students practice at the residence and provide periodic concerts, have an opportunity to get to know these residents. Another co-housing example would be a really brand new residence option that the LA LGBT Center has created. They had housing for homeless older adults and are now co-housing youth who are homeless LGBT individuals with the intention that they can be a resource and mentor to each other. So this is just a tip of the iceberg, if you will, in the kinds of things that are out there. And it's pretty cool. These types of integrated programs can reduce ageism. The research tells us that this is often the case, right? And I have that qualifier, it's often the case if the programming is done well. Experience Corps is the best studied intergenerational program out there. It has been replicated in 22 urban areas, under-resourced schools. It is, it is associated now, I want to say, with AARP, but I may have that wrong. George Reebok and Nancy Morrow Howell, Irwin Tan, there's some pretty well-known gerontological researchers who've been involved with this. It's a remarkable program. This program was developed for old people, with the idea that there are other needs that can be supported by linking the generations. Qualifying older adults, and they have to meet a lot of qualifications with regards to literacy, availability, some physical mobility, and of course, background checks. They make a significant commitment of 15 to 20 hours a week over a 2-year period to be in the classrooms of kindergarten through 3rd graders during the school year, helping with their reading, as this gentleman here in the picture is. The research is pretty phenomenal. The older adults have got greater physical activity, their cognition improves, they experience greater engagement in meaningful roles, experience greater achievement of generativity. For the young people involved, their reading improves at a greater rate than children of similar reading levels who don't have this kind of help. And a recent study has also demonstrated improved socio-emotional learning, which is so important for any young child to succeed going through school. And of course, we know it's important in life. What else is really cool, that the sample sizes for Experience Core are so large, and they follow these kids as long as they're in the program, that they are able to attribute a dosage effect to the outcomes. So those children who have more sessions with the Experience Core volunteer, they have better outcomes than the people with kids with fewer experiences. The older adults who volunteer more hours in the program, they experience greater achievement of generative desire than other volunteers who have fewer hours. I have age-friendly communities listed here. They are variable all over the country, all over the world. WHO started out with age-friendly, and it is an idea that if we can make communities friendly for older adults, they'll be friendly for everybody. It's kind of a version of universal design. I think that it is an opportunity that in many communities is missed for its potential to integrate the generations. So we'll hear people talk about making the physical environment more accessible, making businesses more accessible, providing opportunities that older adults feel comfortable accessing. It does not necessarily mean that this is a community that is committed to intergenerational friendly, right? You can create communities that are accessible to parents with baby buggies, people in wheelchairs, older adults who may have scooters or walkers. But if you don't build in a design feature or resources that would lead them to be together, it may not be quite the optimal circumstance of trying to reframe aging, reduce ageism, and help reduce age segregation. So I'll offer that as something that really has to be done well. I am going to move along, and I'm going to guide you through this infographic, so don't try and read all of it at once, and it is available at gu.org. Not only are intergenerational programs effective, but people want to access them. If we take a look at this upper left-hand corner, it looks like a folding map. Most people will indicate that they would rather access services that are, I think I've got myself in the wrong corner. Now that this slide is big enough that I can actually read it, I apologize for that. On the lower right-hand corner will tell you that most people, if they need services themselves or if a loved one needed services, they'd want to be able to get them in a setting where multiple generations are served. If we keep moving clockwise, this public opinion poll, this was data gathered in 2018 by Generations United. Public opinion is that they would endorse support from government leadership and government funding to increase the opportunity to connect the generations in multi-generational service settings. The kind of places that they identified for these types of services won't surprise you. That's in the upper right-hand corner: schools and universities, senior centers, youth centers, churches, and other worship places, recreational facilities. The challenge is that if you look at the bottom item in that left-hand corner, 26%, almost everybody wants to access these services. Hardly anybody knows where to find them. This is a challenge of framing for the providers that offer these services. It's an obstacle for sure. I'm going to tell you as well that these organizations, practitioners, they face challenge in implementing good, quality, sustainable intergenerational programs. This is a survey that I directed in 2018, also with Generations United, and it was of practitioners. One of the questions we asked was about challenges they face operating intergenerational programs. Number one challenge, demonstrating impact. These groups know that they have to evaluate what works and how they can keep making their program work if they're going to succeed in securing funding, which is their number two challenge. And their funders are requiring them to demonstrate impact. This is something Shelby and Karen and I have come together to try and address. What are the issues with measurement and how can we help to be a resource to make this easier? I'm going to only talk about the third challenge as well, and the rest, well, we can get to. Finding other programs to share ideas. I do a lot of work with Generations United. They routinely tell me that they get a phone call from a group that says, hey, we have started this new program. You'd never believe what we're doing. And they can look in their database and say, well, there's another one just like it 30 miles from you. There's something about how these groups communicate or enter their search terms or make themselves Googleable that they think they're developing these programs over and over again from the ground up, rather than being able to find other programs to share ideas. We need some attention to framing there. You can guess that safety concerns relate to COVID issues, transmission of contagion, as well as the potential for needing greater supervision, making sure that old and young people, when they're together, are supervised by the appropriate staff, or the background checks are being done on adults. Space is sometimes just an issue of needing to rely on donated space because of funding challenges and how sometimes it is not really accommodating of the young and the old people there. So what do we do about this? I'm going to be brief on this slide, but it wouldn't be a Shannon Jarrott presentation if it didn't reference contact theory. And we are fortunate to have the work of Gordon Allport and his student, Thomas Pettigrew, who I think is still working as emeritus faculty at UC Santa Cruz at the age of 90 is my best estimate on him. People have studied theoretical tenets, mechanisms of change, and precise behavioral indicators for their impact on intergenerational relationships. So besides having the human development theories that I'm most familiar with, indicating why the generations need each other, Allport's contact theory helps move us towards reframing the context setting, recognizing that society has a shared responsibility to foster positive IG relationships for the good of all. And what Pettigrew has contributed is these mechanisms. So if we know that getting people together, we should have these different circumstances. People should have equal status, meaning recognizing that they have something to gain from and something to contribute to the situation. They should be working together instead of competing against each other. They should share a goal. Authority support is really important to know that administrators and staff and families, tradition support the idea of bringing the ages together, and there should be opportunities for friendship to build. Pettigrew would tell us that we got to make sure that people are learning about each other, that they're building skills of empathy, and that their anxiety about the other age group is being diminished as well. These really can help to guide our practice. And if you want to know more about contact theory, I'm really happy to talk to you about how it relates to intergenerational programs. I feel really fortunate to be joining in efforts to respond to ageism and how intergenerational programs can help to reduce ageism and to reframe aging. Glad to be working with John and Shelby and Karen on research that helps to add psychometrically sound measures to be working towards getting large enough samples. One of the real challenges, I've done a screening analysis, a scoping review of the intergenerational literature published in the last 10 years. You can hardly find anything with a sample that's larger than 30 or 50 people. It makes it really demanding. You can't do analyses of what are the mediating and moderating factors. So it makes it hard to know why something is working or isn't working. Evidence-based resources for practitioners, that's something that they told us they wanted in our survey. I'm fortunate to have a couple of resources out there, starting in that upper right corner, the Extension Campus. This is part of Cooperative Extension System. We have a continuing education class on intergenerational evidence-based practices that people can sign up for free, get continuing ed if they need it. In 2019, the Intergenerational Evaluation Toolkit was published by Generations United. I created that to help practitioners to draw from psychometrically sound measures instead of coming up with their own. A lot of time these folks aren't trained as evaluators, but they've got some guides there in that toolkit. There's policy funding that supports intergenerational programs, even though we know it is also segregating. So for example, the Older Americans Act was reauthorized earlier this year, and in it was a good bit of language from the Aging Together Act. Senators Jones and Casey put this act together, and it includes language that provides incentives to deliver services multi-generationally, to provide older adults with meaningful roles for engagement, and delivery of services to multiple generations in a single place. So that's really exciting to me. And we are slowly but starting to see that funders are specifying preferences or even exclusive focus on funding intergenerational issues. As Karen described, the Retirement Research Foundation for Aging is concentrating on intergenerational initiatives. The Eisner Foundation exclusively funds programs that are dedicated to intergenerational solutions. And as Karen described, CIFAR, which is interested in children, youth, and families. We know old people are parts of families too, but they have been accepting of intergenerational approaches to meeting the needs of those young people. So there are opportunities to respond. I'm gonna be there every step of the way. I'm pretty excited to see some of these changes taking place. I'm gonna check in on time. And I think I'm out of time, aren't I? I am out of time. Yeah.
You're pretty much, if we want to have time for questions, if you want to just quickly go through anything, but we probably should, you should wrap up soon. Yeah.
Somehow, when you practice this at home by yourself, it goes a little bit faster. I'll leave this one up there. There are, there's a lot of programs that have had to stop their offering because of COVID-19. There are also new programs that have responded, like Empowering the Ages, Sharing Smiles. People can indicate that they would like to write a letter that's shared with an older person or receive a letter from a younger person. No personal information is exchanged. It's all routed through Empowering the Ages. That's a picture in the lower right-hand corner of a gentleman receiving letters. They've had like 400 exchanges so far. There are virtual volunteer opportunities as well. If you know an older person who's gone stir crazy, or you're going stir crazy, not getting out to engage in your community service. And I think with that, I'm gonna leave you to probably sort out why the old people in your life aren't self-isolating. You know that. Thanks for your time. I'm really sorry for running over. And I've got here lower left-hand corner, right hand, my mom, and my son is graduating next weekend. For those of you who are graduating, or your children or partners or siblings are graduating. I really feel for the circumstances we're all in. I hope everybody is able to face it with the best humor possible and be kind to yourselves and each other and stay well.
Thank you so much, Shannon. I really appreciate this very interesting and wide-ranging presentation, and I want to leave time for people that we have about 5 minutes, maybe only 3 or 4, but if anybody has questions, please feel free to jump in. You've been thanked for a lovely talk by Carolyn Aldwin. Well, I just want to give one example in Corvallis. Recently, the preference for intergenerational settings, I think, is pretty strong here. They just changed the moniker of the senior center from senior center to the Corvallis Community Center.
Nice.
Hoping that it will draw more intergenerational programming to that community space.
That's terrific. I hope it works.
Other questions? Well, I have a really practical one. Shannon, you've started a few of these programs from scratch. What do you think is the biggest barrier to really beginning a new intergenerational program? And I know you're saying, don't start from scratch. We have all this experience. But for someone who's even trying to start either a new idea from scratch or build on previous intergenerational programming, what do you think is a barrier that you could maybe kickstart people past?
Yeah, I think it is about identifying what need it is that you're responding to, and then especially if you're working across organizations, is to see if the two or the partnering organizations can identify an intergenerational mission. Something like that helps contribute to that contact theory tenet of authority support. So often we've got one person who's really enthusiastic and excited about a program, and they kind of make it happen by sheer force of will. And then that person leaves, and they haven't laid the groundwork to make it a tradition that outlives them.
Good point.
Yeah. Beautiful Friday afternoon in Corvallis, and probably people are happy to enjoy things. The sun has even come out here in Columbus.
Yeah.
I'm going to get out there and see you one of these days.
Well, we are so anxious to have you come out here, Shannon, and we will let everybody know, of course, on your first visit, not next visit, your first visit beyond the virtual visit today. Mm-hmm. Well, I'm not seeing any questions, so perhaps we're almost at the end here. 1 more minute. Anybody have any burning last question?
I have a question.
Okay.
If it's all right, and that is, what do you think about, this is just me thinking out, why, like I talked to my parents, and my sister and brother have said, why are they running around like they are? And I haven't confronted them about it, because who's going to tell my mother or father what to do? Would you add other reasons to why older adults are not self-isolating?
I don't know if that's anecdotal with your very active mom, who I think I've met, and she's amazing, or if that's a general, I don't know. Shannon, have you seen any statistics or any reports that this is a common thing?
Shannon, we're in the middle of collecting data on precisely that question. And we find that about 75% of the older adults in our study who are from the Life Registry throughout the state of Oregon report social isolation and or sort of sheltering in place. They do go out daily, but most of the time it's really for either getting medications or groceries, or the big thing they seem to be doing is gardening. I wish you could be out here right now because everything is blooming and it's gorgeous and my allergies are driving me nuts. But there's all these folks out there working in their gardens as a way of substituting, I think, a little bit for going out and visiting.
Yeah, yeah. That makes sense, and that sounds like something you can do under these orders of sheltering in place. And but you know, even for my folks at 74, I think like, well, there's so and so, and she has a cancer diagnosis, and she can't go out and do these things, so I'm going to go out and do these for her. So I've just been watching and wondering what if other people are worrying about people that they care for, taking good care of themselves. I wish I could see the gardening too. I'm going to make it there. And I wish everybody a great afternoon.
Thank you so much. Shannon. We really appreciate your expertise and time today. Thank you.
Thank you. Thanks so much. And thanks for having me, Dr. Harvey, Dr. Hooker, Dr. Aldwin, Jacob, and Gretchen. Thank you.